My name is Harry Dougherty, and I'd like to share with you an interesting case. I've been in private practice for 26 years and have had the pleasure of teaching diagnosis and treatment planning at USC as an adjunct professor. This case has several treatment options, the consideration of which makes this case interesting and fun. How would you treat this malocclusion? A 23-year-old Caucasian female presents with an anterior open bite. She has a history of previous orthodontic treatment at age 12, in which she stated that her open bite was closed at the time of debanding. She has a straight facial profile. Her chief complaint is her inability to bite into food, and she is also unhappy with her smile. Extraoral findings. Facial evaluation shows a mesocephalic facial type with lips strained at closure. The patient has a symmetric face with a slightly long lower facial third, a thin upper lip with an obtuse nasolabial angle, a low smile line, and a reverse smile arc with excessive gingival display in the premolar areas. Intraoral findings. The patient has a class 1 molar relationship with maxillary crowding, an edge-to-edge bite on the central incisors, and a 0.5 to 2 mm anterior open bite. The midlines are coincident. The curve of spee in her mandibular arch is flat, and there is an accentuated curve of spee in the maxillary arch, which could be best described as a two-plane occlusion. Radiographic findings. The Panorex shows good bone level, apical root resorption of the maxillary anterior teeth, and blended roots of the mandibular anterior teeth. She has a skeletal class 1 with a normovergent growth pattern. The maxillary incisors are retroclined and the mandibular incisors are proclined. Habits. The patient has a mild tongue thrust when swallowing, but no problems with phonation or speech. In treating this case, we have several treatment options. Treatment option 1. Comprehensive orthodontic treatment, non-extraction, with interproximal reduction on the mandibular arch. Class 3 and anterior vertical elastics would be used to close the open bite. Treatment option 2. Comprehensive orthodontic treatment in combination with orthognathic surgery to intrude the maxillary posterior and close the open bite. Treatment option number 3. Comprehensive orthodontic treatment with temporary anchorage devices assisted mechanics to intrude the maxillary posterior segments and retract the mandibular incisors. Treatment option 4. Aligner therapy with TADs to intrude the maxillary posterior teeth and retract the mandibular incisors. If you are interested in how this case was treated, please go to the PCSO Bulletin 2015 Winter Edition for more information.